As Orian's just explained, I'm Sophie, I'm 32, and I'm here quite simply to tell you about my life with cystic fibrosis and how taking part in a research trial changed it significantly. So I think it makes sense to start right back at the beginning. So let's go back to 32 years ago, 1992, and I was born. The youngest of 4 siblings. I was born to parents who had no idea what cystic fibrosis, or CF, was, and at birth, at this time, they didn't yet know that I had cystic fibrosis. So the first 3 months of my life, my mum tells me that I was very unwell. As she'd obviously had 3 other children, she knew that there was something not right with me, but at that time, unfortunately, the healthcare professionals she was working with were insistent that there was nothing wrong with me. My mum says that I was unable to breathe through my nose, so I wasn't able to have a bottle, so she resorted to spoon feeding me milk. And then eventually they decided that I was a failure to thrive because I wasn't putting on any weight. Fortunately, my health visitor at the time had a husband who was a doctor, and he happened to know about cystic fibrosis. So when my mum told the health visitor that there was something wrong with me, and she could obviously clearly see that something wasn't quite right, she got straight on the phone to her husband, and his advice was, take that baby straight to A&E and ask them to test her for cystic fibrosis. I was tested, and lo and behold, I was diagnosed at 3 months old with cystic fibrosis. So here's some photos of me with the consultant at the time. So the one on the left is a consultant showing my mum how to give me physio. For those of you, because I'm aware that some of you might not know what cystic fibrosis is, and I think it's important for me to share at this point. I'm very much here to speak from a patient perspective, so I might well, throughout this presentation, get the science side of it wrong, and also like the actual official process of the research that I took part in. But I thought it was maybe more interesting to you to hear about how I've interpreted that and what it means to me and my life. So cystic fibrosis, it's a genetic condition that affects the way salt is moved between the cells. So that produces a really thick, sticky mucus that clogs the organs and makes the perfect breeding ground for infections. Cystic fibrosis affects the whole body, but for me, it mainly affects my lungs and digestive system. For those of us living with CF, life expectancy is significantly reduced. So when I was born, my mum did ask, how long it might be that I live, and they said to her, whilst they couldn't predict that, in 1992, there were very few people living with CF still alive, aged 30. So my childhood, you can very much tell that I was a child of the 90s. So I reflect that I had what I would call quite a normal childhood. I fought with my siblings, I went to school, couldn't quite get out of that, and, had hobbies and just got on with life, really. However, there were some things that living with cystic fibrosis brought with it. So I did have to go to regular hospital visits. I also remember, I needed to take pancreatic enzymes, and I thought this was normal, but obviously then went on to realise this was totally not normal, that every time I ate a yoghurt or mashed potato, there was enzymes mixed in with it. I had to do daily physio, which you saw in the photograph before. At that time, it was percussion, so my mum patted me on the back. I also remember having to go to see the head teacher at school before lunchtime because she would give me my tablets that I needed to take. I also had to eat a significant amount more food because my pancreas wasn't working properly. I would need to have extra calories. As a child, that was quite a good thing, actually. I also remember my mum, around winter time, used to go slightly crazy about making sure people were washing their hands. I wasn't around snotty kids, which you can imagine, that's sort of impossible. And I had a cough, and it was quite normal for me to have a cough. But what I do remember, and I think now I realise how important this was that I was brought up by a mum that at that time told me that having CF made me special, and that whilst it was really important that I looked after my CF. It didn't have to stop me doing anything. So here I am, I grew up, went into my teenage years. And this is, I guess, when things, I maybe started to notice cystic fibrosis creeping in a little bit. So I remember as a teenager, I learned about the life expectancy. And it, on one hand, it sort of really terrified me. But I think at that age, you sort of don't really grasp exactly what that means. But I knew it wasn't a good thing. But it also taught me and made me realise, oh, well, I might not be here for a long time, so let's have a good time while I'm here. And I started to cram things in a little bit, just in case I wasn't here for very long. But also my treatment regime increased. So as a teenager, I started to have to do daily nebulizers, which at that time I wasn't very good at. I started having to take more tablets, and I started to understand what those tablets were for, and also then my mum was really good at trying to give me a little bit of independence, so trying to encourage me to take part in making sure I was actually adhering to my treatment regime. But then you'll see in the photograph on the right of me, I think I was about 17 there, you'll see actually I've got a bandage on my arm because I was on a course of intravenous antibiotics at that time. So I think it's important to say here that whilst I was doing all that, at no point did I let CF stop me. So the photographs on the left are me in Ireland doing my Gold Duke of Edinburgh's Award. And on the right, I was at a party. But I just so happened I was on intravenous antibiotics for a chest infection, but it wasn't going to stop me going to the party. So there I am. And I think that at this time then, what I started to do was find ways to make sure CF fitted in with my life. So it was never the other way around. It was always about my life first and CF second. And so, for example, when I did my Gold Duke of Edinburgh in Ireland, I had a little portable nebulizer in my rucksack. And I think at one point I sat with the most epic view on a rock doing my nebulizer. So there you go. So I made it fit in. And it was also then about me. And then, I went on to university, and I was very fortunate to be able to go to London to study at drama school. And that was a really big learning curve about how I was going to live my life, but also balance CF. And I think that at that time, I also learned that if I wanted to live the life that I wanted to, I first had to do my nebulizers and take my tablets. But as I'm sure you can imagine, that wasn't always so smooth. But I also then started to learn that on the days that I chose to party instead of doing my medication, there were repercussions, and then that I would become not very well. So here I am. This is my university days and then going into my early 20s. So yeah, as you can see, it didn't stop me. But things, so once I hit my early 20s, so I'd graduated from university and I moved back to Pembrokeshire. It was a really exciting time for me. I was deciding what career I was going to do. I was doing lots of different jobs in youth work and community arts. But at the same time, my health was starting to deteriorate and I was starting to really notice that living with cystic fibrosis could be really hard. So I started to notice that, from my childhood, I managed to go my childhood without being admitted into hospital for intravenous antibiotics. From what I think I had a course when I was 3 years old, and then the next course I had was in the previous photograph when I was 17 years old. I was incredibly fortunate to be able to do that, but then obviously when my health started to decline, it was it was quite difficult because I felt like I'd got away with it until that point. So in my early 20s, I was spending more and more time in hospital having intravenous antibiotics. And at the worst year, I believe I spent 10 weeks that year in Llandoch Hospital. I was also having to do about 4 nebulizers a day, and that was just standard. When I was unwell, that would increase. And that could take up to a couple of hours. I was having to take about 30 tablets a day. I think the most difficult part of living with cystic fibrosis at that time was that literally I could go to bed feeling sort of, I say well, to the average person it probably wasn't very well, but my level of well. And then I could wake up in the morning feeling very unwell and needing to be admitted into hospital for intravenous antibiotics. So that made it really hard to plan my life and to just live my life as I wanted to in my early 20s. It was really unpredictable. And the impact of that is that it felt really challenging at times. And I think at that time as well, I think I was living with about, at the lowest, about 55% lung function compared to that of somebody with the sort of same age and characteristics as me without cystic fibrosis. So it's quite a significant reduction. And even though by this point I'd really worked out that I needed to look after my health if I had any chance of sort of continuing to live the life that I wanted to and to sort of continue to be alive, I realised that I needed to prioritise the nebulizers and medication, and that going into hospital was just part of my life that I had to accept. But it was really difficult because even though by this point I was prioritising it and I was doing everything and working as best as I could with my CF care team, my health overall was still slowly declining. And I guess that's that's quite hard to be faced with that, particularly in your early 20s when your friends are, it's supposed to be a really exciting time, I think, your 20s were really carefree, and there was that element for me, but it was sort of overshadowed by this real level of uncertainty. And so, for example, at that time, I had really poor vein access, so I was having to make a decision about whether I wanted to have a port fitted, which I went on to do. But that's maybe not something that ordinarily you would have to be making those decisions at such a young age. But whilst all that was going on, again, we're going to come back to this, I never let it stop me. So I was doing all of that, but I was also doing all of this. So the picture on the bottom left, I actually went and climbed Kilimanjaro in my early 20s. At the top, obviously, in Machu Picchu, so I went and travelled for, I think, 3 weeks around South America with a friend. Then I also rallied the troops, so I started doing lots of fundraising for the Cystic Fibrosis Trust, and I dragged them all to walk 40 miles in a day over the Brecon Beacons, never to be repeated again. And then I was fortunate enough to travel to India and to Nepal. So I was still able to do those things, but it was really, really hard to live these life experiences. And I remember that before I went on the trip to India and Nepal, I went into hospital for 2 weeks of intravenous antibiotics just to make sure that just give my body the best chance of making it through that trip. So there we come to the research trial. So we get to, I think it was late 2019, and I received a letter through the post for a study to take part in a study for what's the now known Kaftrio drug. At that time, it was really interesting because I wasn't that interested in research. I didn't know much about research, and I thought that there was no way research could impact my life positively. So I didn't see the point in putting my energy into research. However, with this, I had heard about this miracle drug that was being used in America, and I'm really fortunate that I knew that, because when I got this letter through the post, I realised that this drug trial was for that drug. I have never made a phone call quicker to the CF research team, and I was really fortunate that they said that actually there was one space available, and yes, it was mine, as long as I could stay well enough. I think there was about a 6-week period I had to be well for in order to start the trial. That was really hard in itself because it was winter, and winter is a nightmare for people living with cystic fibrosis because coughs, cold, bugs, and often I would spend my, a decent amount of time over the winter in hospital. But I somehow managed to scrape through, and I got on the research trial, which is really exciting. So it was really interesting thinking back to the research trial. I actually can't remember the detail of it, which I think is probably quite a good thing, that it was quite a smooth process. But I remember I had to go for, obviously, regular hospital appointments. and at the point of going on the study, so it was a double-blind study, so we didn't know whether I'd be on Kaftrio or not. And I went to the hospital and I took the tablet, and then I left the hospital, and obviously it's a couple of hours drive home to Pembrokeshire. And by the time I'd got back to Pembrokeshire, I felt something started to happen. Now, I was convinced it was just in my mind. There's no way a tablet could be working that quickly. And I just thought I was being really hopeful for a change here. But I was wrong. That evening, I went to the gym as part of my normal routine, and I had to leave the gym after 10 minutes because I could not stop coughing, and it was incredibly embarrassing. So I was used to having a cough, but I could sort of, I could maybe control it somewhat. This was completely out of my control, and it was outrageous. So I went home. That evening, that continued. So I had to sleep sat slightly upright because to lie down was too much. And basically, I'm going to share some really nice things with you now. I spent 24 hours coughing up the most disgusting mucus I've ever seen. A lot of it was brown. And I've now seen that other people report this, having started Kaftrio, and they call it the purge. And that's literally what it was. Honestly, it was just my poor housemates at the time. It was disgusting. And then I've barely coughed since, which is really exciting. My lung function has gone up to approximately 70%. I've put weight on. I noticed, I went out with friends about a month later. I think we came down to London. We went down to London, and we were out for a walk. And I noticed that for the first time in a long time, I was able to walk up a hill and maintain having a conversation with my friends. And I got to something, I thought, that was a really strange experience. I'm not sort of gasping for breath and sort of gone very quiet suddenly. The amount of nebulizers and tablets I need to take has significantly reduced. And the biggest change for me was that my health felt stable. So I was no longer living with that anxiety that I might go to bed and wake up ill the next morning. Didn't really want to I found it quite difficult to plan things too much in advance, thinking, oh, well, I'll have to just rechange things because I might be unwell. My health felt stable, so it was much more predictable. And for the first time in my life, my health was improving, not declining. And nearly 5 years on, that's still the same, which is incredibly exciting. But I think what's really important to say, I still live with cystic fibrosis. So I still do spend time in hospital and doing intravenous antibiotics, but it's just a lot less time. So what did I do with my newfound health? Well, I'd never let CF stop me, so this was brilliant because I could carry on doing the stuff I wanted to do just at a slightly higher level and not be too worried that I wouldn't be healthy enough to carry on. So very quickly, after starting on the drug trial and seeing the improvements, I bought a house, I got 2 dogs, I became a rowing coach, and I guess I started to plan towards a future that previously I didn't think I was going to have. And I think because of living with cystic fibrosis for 27 years, I've got lung damage from that, and that is irreversible. So there's only so much this drug can do. It's not a cure for cystic fibrosis, but it obviously has significantly improved my life. So these are some more recent photographs of me doing my nebulizer treatments and having intravenous antibiotics. But it is definitely a lot easier to have 2 weeks out of life, if you say, to do intravenous antibiotics when it's more predictable to be able to know when that might happen rather than it happening overnight. So now it's quite often if we sort of seeing, or it might be that I need some intravenous antibiotics rather than it needs to happen now, rearrange everything, you need to come into hospital. It's when would it suit you to come in around your work pattern, around any trips away you've got, any plans like that. So it's definitely significantly easier. So, what does my health look like now? So I take about 20 tablets a day still. I do 2 nebulizers a day. I have intravenous antibiotics about once a year. I now maintain my weight. I've got increased exercise tolerance. I've got little to no cough. And again, like I've already said, my health is much more predictable and stable as a whole. So, because of taking part in the clinical trial, I'm now able to think about a healthier future, which brings me to my current passion, obsession, / crazy idea. And this is in line with I'm not going to let CF stop me. In January next year, alongside 3 other women, I plan to row in this very boat here across the Atlantic Ocean, which is 3,200 miles from Lanzarote over to Antigua. We think it will take between 50 and 60 days, and in doing so, I'm aiming to be the first person with cystic fibrosis to row an ocean. It is as crazy as maybe it sounds. But I was thinking about this, and I actually think there's some learning that I've taken from participating in the clinical trial that I can take forward to trying to complete an ocean row. I think part of that is about accepting there's going to be some element of risk. It's about learning from others that have gone before and building on that. So whilst there's not anyone with CF that's rowed an ocean, I can learn from other ocean rowers, but there are some people living with cystic fibrosis that have done some incredible adventures, such as climbing Everest, running ultramarathons, etc. And so it's about learning from what they've done and taking those bits and bringing it to what I aim to do. About planning, but also being prepared for unexpected outcomes. Consistently monitoring what's going on in the lead up and then obviously during the process as well, and then working as a team with anyone else that's relevant to what I'm trying to achieve. And actually, because it's not been done before, the row to me is like an unofficial trial, because we are trying to push the boundaries as a crew of what's possible. But in order to do that, we first have to look at what the challenges are and find like the list of questions we need to answer in order to make it happen. So some of those questions are around, how can we store my medications out at sea? How can we make sure the nebulizers will work in such a harsh environment? And then, of course, what will we do if I do become unwell 1,000 miles from land? So I guess I'm going to wrap up and just say that I can't be sure what my future with cystic fibrosis looks like. There is likely going to be some hard times and potentially, a reduced life expectancy for me. But what I do know is that participating in the clinical trial has given me more time, and time that I never thought I'd have, and that I'm undoubtedly going to fill with epic and ridiculous adventures. I started my life thinking I'd be lucky to make it to 30, and I stand here at 32 years old, the fittest I've ever been, and looking ahead to a life potentially into my 60s. And so I guess what I'd like to say to you all in short is that research matters, it changes lives, and it changed my life. Thank you.